Hi, everybody. I am so glad to be able to speak to all of you today. I just want to say a quick thank you to all of our sponsors here as well. To start off, this is what we'll cover today. Dementia basics, some common scenarios, which I think you may find quite familiar, and some practical approaches for managing dementia behaviors. And of course, at the end, we'll have a lot of time for Q&A for you to bring up your scenarios, challenging scenarios as well. And we'll all put our heads together. Okay, let's start off with some dementia basics. So, dementia is not just memory problems. It often involves memory and other brain functions as well. In fact, we need our brains to help us process language. We need our brains to help us move and move our arms and legs and coordinate how we do things. We need our brains to help us with planning and judgment. We also need our brains to be able to figure out the world from a visual spatial perspective so we don't get lost everywhere we go. And brains also help us process emotions. So it's very global. And a key hallmark of dementia is that it causes problems with function. So not only having trouble with complex tasks, but even everyday tasks as the dementia progresses. And what does this result in? A lot of frustration. It can be very frustrating not to be able to do the things that you just need done. Another common problem that happens with dementia is it causes problems with behaviors. Um, I guess having difficulty with judgment and emotions can also often lead to misunderstandings. And that results in difficulty with behaviors and relationships. And caregivers and family members just don't even know what hit them. Suddenly, it's just getting more arguments lately. This is a graph describing how dementia progresses over time. So early on, when dementia is just diagnosed, we may find problems with memory, word finding, or performing more complex tasks. Later on, maybe a few years later, like 3 years later, 3 to 5 years later, they may have trouble with things like cooking, finances, shopping, and transportation, things that are required to live independently. And as dementia progresses further, may have even more trouble doing basic activities of daily living like bathing, dressing, and grooming. And finally, as they enter their last stages of dementia, um, not being able to speak very much, just a few words, maybe yes or no, um, difficulty walking, sitting, and even feeding themselves. And then ultimately, as this neurodegenerative disease progresses, more brain cells die, and it ultimately leads to death many years down the road. But through all of this, oftentimes we all experience the challenges of behavioral and psychological symptoms. And that is what we're here to talk about today, because this is often the hardest part of caring for someone with dementia. So we'll start off with this. This is a really core concept to understand, Behaviors are communication of unmet needs. Behaviors aren't the way for, our loved ones to get back at us and take revenge. I mean, these are not things that they're trying to do. They just can't find the words and they're unable to cope with challenges. And in some sense, you have to be able to read their minds, or you have to become really good at becoming a detective. And that's what I'm hoping today. We're going to help you be that detective. Get in their shoes and look for that unmet need that they're unable to tell you about. The paradigm I'm going to share with you today is just thinking about that hierarchy of human needs and then being that detective and asking the questions: who, what, when, where, why, how, and hopefully that will help get you to what they're trying to tell you without using words. Okay, in the world of psychology, there's this guy named Maslow, and he created this describe this hierarchy of human needs. And so the very basic one first is physical needs, being able to meet, are they hungry, thirsty, cold, having pain, fatigue, things like that. Those are basic physical needs. The next in the hierarchy is feeling safe. If people don't feel safe, they want to run away, right? Or lash out or something. The other really basic human need, after having their physical needs met and feeling safe, is the need to be loved, the need to belong, and to be respected. Consequences of that is that you just feel depressed and lonely. And then finally, because we are human, we all want some kind of meaningful life, not just be bored. Um, okay, so um, I, I believe many of you have either had children or have nieces or nephews in their toddler stages, right? And we know that they have trouble expressing their needs in words. Sometimes they don't even know what they need. They just get upset and they start being cranky. They can't deal with frustration, right? And what you see is temper tantrums, right? And so what do? You think, oh, shoots, I forgot. They have snack time, or they must be overtired. They need a nap. It's 1 o'clock and it's nap time, and I almost missed that. Or they may be any of the above. They may be thirsty, right, or cold or constipated, so overheated, right? So as we look out for basic physical needs, we need to do that and anticipate that for our older adults with dementia as well. So let's just start off with a couple of examples. So challenging scenario number one. So John hasn't been the same since he slipped from his chair 2 days ago. There were no obvious injuries, and he was able to walk after that. So you thought, okay, so that's done. However, since then, he has been more irritable, refusing to get out of bed and pushing you away when you try to help him. And he yells at you to leave him alone. So here we go. We got this detective guy, right? What's going on? Okay, when does this happen? Well, 2 days ago, something happened. He's different, right? And when does he start acting up? Well, more irritable, refusing to get out of bed when you're trying to get him out of bed. So you put on your detective hat, and what do you think? Well, 2 days ago he had a fall. Now he refuses to get out of bed. Maybe he has pain. Maybe when he fell, he twisted his back, twisted some muscle, and now it's just, oh, he doesn't even want to turn and get out of bed. Just leave me alone, leave me in bed. So yeah, so maybe he has pain. And so what should we do? Perhaps we might want to try some Tylenol, right? So we could do 2 tablets of Tylenol, do it twice a day for like 5 days, and hopefully he'll be over it, right? So that's one example of using that to anticipate what are his basic physical needs that he cannot express. Here's challenging scenario number 2. This is occurring in somebody with a much later stage of dementia, probably in the more moderate to advanced stages. So Anne has screaming episodes every 3 days or so. Sometimes this can go on for hours, and she is inconsolable. Nobody knows what's going on. But we notice that this is usually relieved after having a large bowel movement. So put on those detective glasses, right? When does this happen? About every 3 days, right? And if it's relieved after a large bowel movement, probably she's feeling uncomfortable with constipation. Has anybody of you ever been constipated? It just doesn't feel very good, and it can be quite distressing. So perhaps paying attention to these physical needs, we provide fiber, fluids, and bowel medications to prevent these screaming episodes and feeling inconsolable and this discomfort feeling. Okay, so let's move on to the second need, right? Safety, feeling safe. When you are in an environment that you just have no control over and it's very hard to understand what's going on and you feel a little bit bewildered, it doesn't feel safe, right? So one of the basic things we can do, a lot of older adults, have trouble with vision, and hearing, right? So let's make sure that they have their glasses on, their hearing aids or pocket talkers, or we're doing what we can to maximize that sensory input. Additionally, if they're still able to read and they're early on in their dementia, right, having labels to label where everything is so they don't have to keep on opening every single drawer, and clocks so they know, and calendars so they know where they are, what time it is, and if they're provide a little bit more orientation, have a little bit more control over their environment, and it just feels safer. So let's think about challenging scenario number 5. Rampage. It's 10 a.m. and Grandma is on a rampage. She started emptying all of her dressers, looking for something, and now clothes are all over the room. And now she doesn't even remember what she was looking for. But now she's mad at you because you stole her glasses and you are always touching her stuff and misplacing her things. All right, put on those detective glasses, right? When did this happen? 10 a.m. Probably she's not tired. She probably had a good night's sleep. So, and she probably had breakfast already. So not likely that she's hungry or tired or anything, right? What is going on that she got frustrated with? She was looking for something. All right. So her environment is bewildering to her. She can't find things, like she's mad at you because you stole your glasses. You're always touching her stuff. So maybe we need to just simplify her environment. We need to just do a whole makeover, simplify her cabinet, maybe toss out the stuff she doesn't need so it's less cluttered, label her dresser, and just give her fewer options, you know? Maybe keep her clothes in a separate bin and just keep 2 or 3 items in there that she can choose from that's appropriate for that time. Do something to just make life less frustrating. She'll feel safer. What else helps people feel safe, right? A calm and a comfortable environment, right? Being in a noisy, chaotic place can sometimes just wear on you quite a bit. So just making sure that there are spaces in the house where it's intentionally quiet, soothing, and you could just, zone out and watch the fish, or quietly listen in the living room to some music or things like that. So here's challenging scenario. Oh, all these numbers are messed up. Sorry about that. So repetitive calling out. So mom is watching the afternoon news about about the pandemic, about the wildfires, about the protests, and she begins banging on the table, calling out for you every 5 minutes. And when you ask her what she wants, she can't tell you. She just wants you to sit with her. So let's put on those detective glasses again. When does this happen? In the afternoon, while she's watching the news. So what do you think is going on? Do you think she understands the news? Maybe, maybe not. But what does she see? She sees a lot of distressed people, and they're in trouble, and they're mad. And this feeds off, because even when people don't understand cognitively what's going on, they definitely feel emotions that they may or may not be able to handle. So what's going on? It's driving her anxiety. Oftentimes, people with dementia are what we call stimulus bound, and whatever the stimulus is in front of them, that is what they feel. That is what drives them. So what should we do? Well, in order to help her feel maybe safe again, maybe turn off the TV and then address her feelings and provide reassurance. Say, wow, yeah, all this stuff going on in the world, but you know what? I know that there are actually really good people out there taking care of things. The doctors are out there, the firefighters are out there, the police are really helping, and you know what? Things are going to calm down and things will be okay again, providing that reassurance. Okay, here's another challenging scenario. Feeling overwhelmed. Let's say your sister and family with 3 kids have flown into town to visit mom and dad. And so they had this huge, big family reunion that began very joyfully. So you can imagine family with 3 kids must be pretty noisy, right? And, understandably, they're all happy to see each other. But after lunch, dad became very grouchy. He went into the bedroom and refused to come out all afternoon, and he refused to come out for dinner. And your sister got really upset. Like, Dad, we came all this way. We flew on a plane and we got the whole family together. We spent all this money and you don't even want to have dinner with us, right? Dad waves them away. So what's going on with this scenario? Well, it's happening in the afternoon. What do you think? Think he's hungry? Probably not. He had lunch. Do you think he's tired? Possibly. Might have been a long day for him. He's just not too used to this. And what else? Just noisy, right? Just a noisy reunion. Maybe this is overstimulation and he just needs more quiet interactions. So instead of having him come out, you know, maybe put some quiet music in the room and have the family go in one-on-one to visit with him after he's taken a good nap, right? So needing to change the way the family reunion works, to be mindful that this might be a little too overwhelming for him. This is an example of a safe and quiet environment. That this is called Namaste Care. That is actually kind of conceived of from social worker Joyce Samar. She's one of the friends that I've had when I was working with dementia patients on the mainland, and she thought of this approach where you actually create this very soothing spa-like environment that's safe and quiet. There's a lot of soothing sounds, gentle touch, and gentle sensory stimulation. We actually implemented this in a few nursing homes in Hawaii quite a number of years ago, and have found it quite effective. So let me just describe it a little for you. So what happens is that we have the person placed in a comfortable lounge chair, greeted with very gentle touch, tuck them in with a quilt or a heavy blanket, extra pillows and towels for positioning, and we give a lot of attention during personal care. We're washing the face, shaving, brushing hair in a very gentle, caressing way. We have videos of nature, some music videos, some maybe quiet individual reminiscence, foot washing and lotion, very gentle range of motion, and some family visits. And so this is just some examples of Namaste Care, right? So we have very gentle ADL care and also very gentle range of motion. So that means just, very gently moving the arms back and forth, up and down, and moving the legs and the feet, circling them around and soaking the nails, soaking the fingers. And you know what? This is it. There's no rush. What's the rush? This is the activity. We can do personal care all day long. This is actually a stuffed dog. Looks pretty real, very realistic, but very soft and very soothing to caress. This lady enjoyed her little feather boa, found it very soothing. This bird's chirping, which is quite nice in the morning to wake up to, and just the soothing sounds of a waterfall or kind of thing, structure. Other sensory stimulation that can be very, very nice is the sense of taste. So this is a lady sucking on a lollipop. We found this was actually quite nice because people don't usually, even people with dysphagia and difficulty swallowing, they still swallow their own saliva. So they can just still taste very sweet, intense flavors, and it brings a lot of joy. Massage. Some people don't like to be touched, but some people do. And so it's not like you have to have a professional masseuse, but just very gentle touching can be, the human touch is a very powerful thing. And of course, watching videos for relaxation, for scenery, outdoors. can be very, very soothing as well. Just creating that soothing environment. This is a study that we did. Like I described before, we actually implemented this Namaste program in a few different nursing homes in Hawaii back in 2013. And in one of them, we actually studied this. We actually started this program. We looked at behaviors 3 months prior and then followed them 9 months after enrollment. And we had about 45 patients enrolled in this Namaste program, and all of them were over 89 years old. There was a significant reduction in the percentage of residents with behaviors here, people with at the beginning, and then almost half, right, with behaviors. And then there's also significant reduction in total behavior severity score. So the severity from the baseline to the next quarter was a reduction of the severity of behaviors, particularly with rejection of care. And there was also a trend towards reduced use of medications. Oftentimes we said, oh man, I can't handle this. Doc, please prescribe something, right? Put them to sleep. There's no need for that, right? Because if you do this kind of a program, we found there was a great reduction in that use of the need for needing these medications. And what do the staff find? That there's decreased agitation. They're more responsive, actually, and their skin is better because they're constantly getting lotions and massages. And so their skin is like baby skin, very supple and soft, and fewer skin tears and all. And of course, the staff were happy because this was less aggravating and this really works. And families were more satisfied because they never knew what to do before. And this is just some comments. Her face was glowing. She was smiling. I learned how to use gentle touch. I do not leave feeling depressed, right? So this just gives a strategy of how to interact lovingly with your families using sensory stimulation. So is there evidence for sensory stimulation as a strategy for reducing behaviors? Well, unlike drug studies, these aren't really well funded, right? Because who's going to make money off of this stuff, right? So there are very few studies on non-drug interventions, and there's limited sample sizes. And so the evidence is often based on what we call systematic reviews, and it selects out high quality studies and combines the data from lots of small studies. So this is just what I'm going to show you in the next few slides is just a few findings from some systematic reviews by these authors right over here. So snoozelen. This is something out of the Netherlands. So somebody in the Netherlands developed this snoozelen multisensory environment. This was originally developed for children with developmental disabilities, and they found that this high sensory environment with fiber optic lights, squishy toys with funny textures and bubbles of different colors when they press the buttons, or having a board with all kinds of sensory textures was really effective also for later stages of dementia. And so from one of the systematic reviews, they reviewed 3 large randomized controlled trials of this snoozelen approach. The first study had no significant effects, but the second study showed significant differences on scores for enjoyment and feeling bored or inactive. So they were less bored, had more enjoyment, and then the third study showed significant differences in being more happy and content. So this was probably the biggest evidence for showing that multisensory stimulation therapy reduces behaviors and creates more happiness and contentment. They looked at other types of sensory stimulation, but they didn't find enough evidence for that. Things like shiatsu and acupressure. There was one randomized controlled trial showing that non-aggressive behaviors all declined significantly. Aromatherapy, there was mixed. One study was favorable, one had no effect. Massage therapy, there was actually some improvement in mean agitation scores. And a sensory garden, one study had non-statistically significant decline, one significant, and one with no difference. So these are all kind of mixed. And the main problems with these, even though some of them say that they do show reduction in scores, the problem with these studies is that they're poorer quality. There were limitations in quality, size, design, and selection bias. Whoever performed these studies didn't really control things very well. So it's very hard to be sure that these were actually effective or not. But we do know from this previous study that somehow multisensory stimulation does seem to have some effect. So Livingston did another systematic review and also found that sensory interventions reduced the number of behaviors. There was less agitation in older adults with dementia. So now, the next thing we're going to talk about is actually music therapy. So music therapy is sort of another type of sensory intervention, but it's different in that it actually turns out to be one of the most effective therapies for behaviors. So if you look at all the different types of non-pharmacologic approaches, this one was with Dyer, we showed this is sort of the where you start off. And if there's on this side of the graph, music therapy actually is way down here, showing that it's quite effective in reducing agitation. And these three different systematic studies all showed that music therapy was particularly effective in reducing agitation compared to other non-drug interventions. So what is music therapy? So typically, music therapy, as described in these studies, were music therapy sessions that were twice a week for 6 weeks, and most of them had, therapy 2 or 3 times per week and lasted about half an hour each. And there was a specific protocol. There was a warm-up with a well-known song. They listened to some music, and then they joined in and interacted with the music. And so typically what happened was they found decreased behavior, depression, and anxiety symptoms. I just wanted to share with you a little bit the iPod Music and Memory program. This was actually something that was widely publicized with the Alzheimer's Association, NPR, New York Times, CNN. There was this Alive Inside documentary. If you go to musicandmemory.org, you can actually pull this up and then you can watch this video of this man who had pretty advanced dementia, was pretty non-responsive and just pretty much sit in his chair with his head hung down and didn't interact with anyone. And then they played some personalized music playlists, and it tapped right deep into his emotional core inside his brain, and he started singing. And then it basically brought him back to life. And he was able to interact even after the music was turned off. So there's, a lot of anecdotal evidence demonstrating that music is quite effective in bringing more quality of life back. There are actually not, if you try to look for studies on music and memory, there's actually not any of them out there, but I do know there is a large trial going on right now. So hopefully we'll actually have evidence to demonstrate what we already know is quite effective. We know that music therapy, as we mentioned before, has been demonstrated in several systematic studies, but this iPod Music and Memory program specifically hasn't quite been studied yet. But we know that, but it seems to be quite effective. And we actually, there are a couple of nursing homes in Hawaii, including the Manoa Cottage, where every single resident has an iPod and iPod Shuffle with their own personalized playlists that are put in at the beginning upon admission, and then reviewed and adjusted during their stay to make sure that it's the music that really can touch their souls and really bring them joy. Okay, so we're going to talk about the next hierarchy, the need for love, belonging, and respect, because we are human. This is just a basic human need. And oftentimes, because they're not cooperating with us, right, we argue with them, or we try to explain and reorient and stuff. But arguing actually does not help. And arguing, commanding, lecturing, saying, I told you, don't you remember? Forcing them to do stuff and shaming them does nothing but breaks their heart, right? And makes them sad. And that's all they're going to remember, right? Is that you don't love them. So what we always need to do is we need to treat them with honor, and that listening to their feelings does help. So it takes a little different ear to listen to their feelings, not just listening to their words. Listening to the words may or may not make any sense at all, but it takes a little practice, but you can actually listen to see what their feelings are and then try to address those specific things. So we'll show an example here. Here there's another challenging scenario. I want to go home. Maybe some of you will resonate with this one, right? Dad moved in 2 weeks ago, and he has been restless every evening around 4 p.m. trying to leave the house. And when you tell him this is his new home, Mom died and the house was sold, and he gets mad at you and says, you know nothing, and insists this is not his home. So when does this happen? Right? You got to put your detective glasses on, right? When does this happen? About 4 o'clock every day. What does he need at 4 o'clock every day? For most of us, we want to go home, right? We're getting tired. We want to get into our own homes, feel comfortable, the place that's familiar, right? So what is he saying when he's trying to leave the house? He doesn't feel like he belongs here. Maybe this isn't home for him. So maybe we have to do something to help him feel like this is home. So maybe make sure we have more familiar items around and become best friends. And I'm going to introduce this best friends concept in the next slide. So what does being best friends look like? So when you're with your best friends, you feel loved and you feel accepted and you're not lonely and you feel at home. And then after that, once you've established the connection, redirection often works very well. So best friends approach to dementia care is a concept that was developed by David Troxel. And they came to Hawaii to speak several years ago, and I really enjoyed their lecture. And I really like this best friends approach. So what do best friends do? Best friends, they validate feelings, they reassure, they listen. Best friends show affection. They ask for permission. They encourage each other. They give compliments. And they help each other save face. Is this what family members do sometimes? Not always, right? Best friends aren't focused on the task. Best friends focus on the relationship, being present and focusing on the relationship. What else do best friends do? They enjoy each other. They reminisce and talk about the old times. They do fun things together. It doesn't have to be complicated. Having ice cream together is fun and simple, right? Tell funny stories, laugh together, tell jokes. Even if you don't get it, if you start cracking up, right? Everybody starts cracking up. We know that, right? So yeah, and they celebrate special occasions together and make an excuse to celebrate anything. So it's not about the task. It's more about being with the person, right? So it's a little bit of a mind shift. When you're a caregiver, you're always thinking, oh, there's another task to do and I have to get this done and then we have to do this next task. But if we focus not on the task and more about being with the person, change that frame of mind, being best friends can often work miracles. Okay, let's see if we can apply this. It's time for your bath. It's 6 p.m. You and your auntie finished dinner and she has food spills on her shirt. You tell auntie that she is a mess and she should probably have a bath. You tell her to head to the bathroom and you'll meet her there to help her. She is indignant and refuses. She said she doesn't need a bath and she doesn't need your help. So what's going on? Put on those detective glasses, right? Is she feeling loved, respected, like she belongs? Well, not if you tell her she's a mess and that you're going to help her take a bath. That's a little bit, right? Insulting, I think, right? And maybe she's a little tired too because it's after dinner. It's getting close to evening. She's feeling disrespected, and maybe she actually doesn't know what to do. And you're telling her to just go to the bathroom and I'll meet you there to help you. She's like, well, now what? Like, how do I get to the bathroom? And what do I do once I get there, right? Kind of helpless feeling. So what do we need to do? We need to help her save face and provide simple steps. Simplify the the uh, the steps for her. So, for example, we need to give basic information, no verbal diarrhea. So what's happening here is that you just went on a big tirade and that was basically verbal diarrhea. She just didn't need that, right? And just give simple single-step directions. And if no response, just wait, silently count to 10 before asking again. And then ask them to help you. Instead of commanding them to do stuff, say, oh, I need you to help me. Can you help me do this? Can you help me do that? And then show and do things together, right? Let's let's turn on the water together. Yeah, let's do that. Oh, is the water warm enough? Let's check. Okay, can you check for me? Let's do this, And then with everything, visual, tactile, verbal cues all together. And if they're responding, give lots of encouragement. Yes, good job, thank you. Nods, smiles, hugs, lots of strokes, you know? Um, right. And then with regards to the bath, I think there's no need to tell her that she's a mess and that she needs to have a bath. It might be enough to say, you know what? Oh, that was a really great dinner. That was so yummy. And yeah, what was your favorite part of it? Let's talk about the food and how I really enjoyed it. And I really enjoyed eating with you. But you know what? It's getting to be late, and we need to maybe slow down. And getting a nice bath might be really helpful to feel um, pampered and soothed. Kind of frame it differently, and then say, hey, let's just check out the bathroom. It looks like we can do something. So these are just some tips for bathing strategies. This is actually all taken off of the Alzheimer's Association, because this is, something that everybody has struggled with, right? So needing to prepare ahead of time. You don't, gathering everything ahead of time so you're not running around to kind of get ready. So everything looks very calm and controlled. The room and the water is at right temperature. Have a shower bench. Use a handheld shower or scoop so they can have control over the situation. You don't need to bathe more than 2 or 3 times a week, right? Private areas is enough with a towel or a sponge. Washing the hair in the sink might be easier. Maybe have some favorite music ready in the bath or the shower, and establish a connection before making the request. Maybe don't use the word bath. Maybe use spa. Maybe let's freshen up before bed. And even if it's early in the day, you can suggest a reward. For example, some people said, oh, we're going to the doctor, so we need to take a bath and make sure we're all clean before we, see the doctor. Or, oh, we're going to go out for ice cream, so let's take a bath before we go out for ice cream, and then talk about the ice cream during the bath. And of course, tell them what is happening one step at a time, providing visual, verbal, and tactile cues. And of course, giving limited choices so that they're in control, right? You want the red towel or the blue towel? Ask them to check the water. Give them a washcloth. Even if they can't help, they can hold the washcloth, right? And it actually keeps their hand busy so they're not grabbing at you. And allow them to do as much as possible. Laying a towel over the lap to protect privacy, and then using a washcloth to clean underneath the towel is another strategy for privacy and honor and dignity. Starting at the feet and slowly moving up is less threatening. and then playing soft music to relax them. A lot of distraction by talking and singing and asking them to hold things for you, to help you, and lots of encouragement along the way makes for a much easier bath. Okay, so I'm gonna move on to, after we've talked about sensory interventions being effective and music therapy being effective, and the next one we're going to talk about is this person-centered care and communication skills, also very effective in reducing behavioral issues. You know, how, you know, honoring the person for what makes them special and honing your communication skills, right? There's a certain way of speaking when you speak with somebody with dementia. So here is another scenario here. Restless wandering. Harold has been rolling himself around in his wheelchair up and down the hallways for hours at a time. He does this every day. Sometimes he tries to stand up and reach something, rummage through closets, or get up and walk, or toilet himself on his own, and you are exhausted because you cannot keep your eye on him for every waking minute. Let's see, what's going on here? Well, all of his physical needs have been met. In fact, you keep on giving him snacks all along the way, right? And he's definitely toileted himself enough along the way, and he's not constipated, and he's not um, cold or hot or hungry or thirsty. You definitely took care of that, right? This is a very safe environment, and he really enjoys rummaging through things, right? Um, he's quite happy. It's not like he's upset or anything. He's not yelling at you. He's not telling you to get away, right? He's fine. But maybe um, maybe he's just bored. Maybe he's just looking for something to do. This is happening all day long. And so what should we do? Maybe we need to keep him busy with meaningful activities. I mean, I like to think of it, what would you do with a toddler that comes to visit you in your house, or who lives with you, right? Um, do you just leave them alone to figure out what to do with themselves all day long? Or you actually find activities? You have to actually go find new toys. You actually have to give them something to color, or a magazine or a book to read, or you have to provide them with something to keep them busy and something that they enjoy, right? They're not going to do something they hate doing, right? They don't like coloring, they're not going to color, right? Um, so yeah, we need to, if you don't want to be running around the house following him everywhere, maybe we need to think about what can we do to keep him busy with meaningful activities. So we all want a meaningful life, and this looks different in people with dementia, but basically, you know, meaningful activities need to be person-centered, something they enjoyed. If they always like music or art, then you need to find something related to what they've always loved and enjoyed, right? If it's gardening, then we need to look at plants and take care of them, right? They have to be valued by adults, right? Something that's always been who they are, and they value that and they find it meaningful, engaging, and also failure-free, right? Because if you give them an activity that they're going to fail at, they're just going to get upset and they're not going to want to do it, right? So we have to be very creative about and mindful about that, but also providing continuous programming during their waking hours to make sure that you always have something lined up for them to do. So meaningful activities include work activities such as gardening or cooking, helping peel potatoes, or I had another patient whose family found that she really enjoyed peeling garlic. And it was great because she spent all day peeling garlic, and they had lots and lots of jars of garlic that was peeled, and they were able to give them to friends and family and everybody else. And that was just, helpful and useful and fun. And peeling carrots and tomatoes, things like that. Not tomatoes, potatoes, right? Um, Other types of work activities can be meaningful. Self-care is meaningful, right? Being able to say, oh, I want to exercise today, right? That's a very meaningful thing to do, and exercise with them. Even getting your hair done or your nails done is self-care, and it's quite meaningful. They don't have to do anything. They just have to sit there and, admire themselves and be complimented. right? Leisure activities, right? Flower arranging is failure free. No matter how you put the flowers together, they're always going to look pretty somehow. And so it's very creative. And artwork is also very fun to do, especially if you always enjoyed uh, art. Leisure activities, doing fun things, flower arranging, bingo, playing games, watching musicals, watching movies. Um, yeah, some people just love musicals, and you could just watch the same musical over and over again, or the same movie over and over and over again, right? If you liked Westerns, then you watch the same Western movie, like, every single day, right? That's fine, as long as they enjoy it. Other leisure activities, a lot of folks in Hawaii enjoy Las Vegas, right? And so there's a lot of stuff online that you can do and really enjoy. Other relaxing activities include just sitting on the lanai. If you have a koi pond, you can just watch the fish or a fish tank, petting a dog, feeding the dog, even napping and holding hands, or a gentle massage. These are all relaxing activities that can be done in the middle of the afternoon when they don't need to be overstimulated. Reminiscing is also really nice. Reminds them, brings them good memories. And of course, find something to celebrate all year round. Every single month has something to celebrate. And so just take advantage of that. And then you could do it even more than once a month, right? You can do a birthday for a whole week, right? You can do a birthday week or whatever. So, and then of course, if you've noticed, right, there's National Donut Day, National Chocolate Day, National Cupcake Day. There's a million things foodies can enjoy. This is an example of music therapy. And the key to music therapy is that it should be interactive. So it's not just music playing in the background, but you're engaging with them, singing, playing an instrument, or tapping, moving, dancing, exercising, reminiscing, or live music. So as long as you're interacting with the performer, with the music, that's essentially what effective music therapy is like. YouTube is an amazing thing. You can find virtually any kind of music you want, and sometimes it's a great way to start your day. This guy always loved to start it every morning. That's what he started with. That's how he started his day, with his favorite performers. And I like to take from here. This is from Jolene Brackey. She said that a person with dementia lives from moment to moment, right? They don't remember the past, or they can't really worry too much about the future. A person with dementia lives from moment to moment. So we need to focus your energies on creating moments of joy. So like we said before, right, you have to become best friends and create moments of joy. And hopefully that journey with dementia will become less frustrating and more fulfilling and more rich. It's important to put your dementia team together because, as you can see, with all these behaviors, this can be very, very challenging, and also the increased needs. This is a team sport. And so you have to create a safe pod of caregivers, right? And familiar to the patient as well, right? Create a game plan together. Who's going to cover Monday and Tuesday? Who's going to cover mornings or afternoons? Who helps with doctor's appointments? Who helps with the finances? Are weekends different? Do I have personal time built in for myself? Um, Perhaps joining a support group would give me more ideas about what I can do to be creative. And then, make sure that you monitor yourself for caregiver burnout, because this is very real and very common among people who actually, it's even more common among people who are caregivers for people living with dementia. One thing that will make life easier for you is to make a daily plan and to create a predictable schedule. Just as you have a schedule for toddlers or children, this will help them to just know what to expect. Even if they don't know what to expect, there's some, I guess you feel safe when you have consistency every day. So, for example, If you have, you do wash, brush your teeth, then you get dressed and you prepare to eat breakfast, you have a conversation over coffee, you discuss the newspaper, you do a craft project or even reminisce over old photos, you take a break, you have some quiet time, do some chores together, you take a walk, and then it's lunchtime, So if you have somewhat of a predictable plan, this will also allow others to help. So if you are not able to be there that day because you have a doctor's appointment and somebody else jumps in, they know exactly what to do because it's the same routine every day. Very predictable. It helps them as well as you, and everybody feels safe and comfortable. So having a plan will help allow others to help you as well. And this is just an example, right? Be aware of caregiver burnout. Um, there may be possible impact on your work, financial situation, your family, your health. Oftentimes caregivers put their health aside and they're like, I don't have time to go see the dentist. I don't have time to go see my doctor. I need to take care of my knees, but who has time for that? Also, it has impact on your emotions. Caregivers often have an increased risk for depression and anxiety, particularly among caregivers for people with dementia. And there's also an increased risk for elder abuse or neglect. Not that it's intentional. Nobody really intends to harm anyone. But if you're tired and you're exhausted, you just can't go in there one more time. You're going to just take a break and say, look, I can't do this, right? And then neglect happens, right? So these impacts are very real. And so I would encourage you to just keep an eye on that. And there are actually caregiver strain indexes and burnout tools that you can probably find. And maybe your doctor has some that you can make sure that you periodically take a look at it, take a little temperature check on yourself. And do not be afraid to ask. There's nothing shameful for asking for help because this is one of the hardest jobs ever. Have a plan B because sometimes caregivers get sick. You can get sick too, right? Nobody plans to get sick, right? And know what you're going to do if you're going to hire a caregiver. If there's adult daycare you want to consider, you might want to visit them in advance so that you know that you can call on them when you need to. Going to a care home or a nursing home at this time with the pandemic, you may just be aware that you may have limited access for visitation. So that's something to consider. But the most important thing is that your loved ones should get the care that they need. Sometimes people want to just tough it out and keep them home as much as possible. But then if they're not getting what they need at home, and in fact, they're getting neglected or they're getting yelled at because you're frustrated, that's not what they need, right? And then sometimes it is better to have respite, even for a short time. And finally, this is the summary slide for what we talked about today, right? Important. This is behaviors is also often communication of unmet needs. So we need to do our detective work to find the unmet need. We'll look for physical needs first and anticipate and prevent these issues. Then we think about safety needs and work on creating a nice environment that is calming and soothing, right? That's not overstimulating, such as a namaste environment. And then making sure that you focus on the relationship and not the task. Learn how to become best friends, learn how to listen for feelings and to address those feelings. And then creating a meaningful life. Create moments of joy and particularly pay attention to include special activities and music. And then finally, make sure that you build your team and have a plan. And I think with all of these together, um, you may find a little bit more joy in that caregiving journey, in managing your loved ones with dementia behaviors.